is let's study the normal pancreas and how to scan it. What is the scanning plan? What are the scanning angles that you will be employing for the visualization of a normal pancreas? This is the xiphoid process, and this is the subcostal region, and this is the epigastric region. You know, pancreas is a retroperitoneal structure. So what you do is you place the probe just below the xiphoid process and ask the patient to take a deep breath, lamba saans lena, and hold it. This is method number one. If you get the pancreas in this way, fine enough. Otherwise, you will, let's see first this on the screen. Now, pancreas is a retroperitoneal structure, and if the left lobe of the liver is enlarged bit or exceeds the body of the pancreas, it becomes an excellent window to visualize the pancreas in transverse section. Now, the landmark for the identification of the pancreas, that is, that you are really seeing pancreas and not some other structure, is the splenic vein. Now this is the splenic vein, okay, and here is the superior mesenteric vein. Remember, this is very important because vessels are usually the most important landmarks for the identification of an organ. Now I have placed the probe just below the subcostal region, and I am going to ask the patient to take a deep breath and hold it. He has taken the breath, and here you see he has taken the breath, and what you see, it's hospital, banikalka. Again, deep breath, and you bani nikal, lamba saans. Here we are, saans. This is the splenic vein. This is the superior mesenteric artery in transverse section. It has echogenic borders. This is the aorta, and this is the body of the pancreas. Okay. The outer surface of the pancreas is smooth and regular. Its body measures 12.9 millimeters, and it should not exceed 20 millimeters. So the dimensions are normal. Now its echogenicity, compare its echogenicity with the liver. So its echogenicity is less as compared to that of the liver. So it is within normal, it is homogeneous, and if this is the echo brightness and echogenicity of the liver, then that of the pancreas will be considered as normal, if slightly less. However, this echogenicity or echo brightness varies with age. As the age advances, the echogenicity also enhances. Now this area, which I am encircling now, is the tail of the pancreas. This is the tail of the pancreas. This is the body of the pancreas, and you see a tiny slit-shaped area you are seeing with lumen inside, black lumen inside. This is the pancreatic duct. This area where the star is blinking is the pancreatic duct. So if you are lucky enough to see the pancreatic duct as well, that's good. Okay. Then place the probe again in the same region and here place the probe in the epigastric region, give it a 90-degree sweep, and you will see the aorta, pancreas, and the left lobe of the liver in transverse section with portal vein. These structures will be visualized if you place the probe just below the xiphoid process and give a little angling if you need, in case if you require that. You can maneuver the probe sideways. So let's do it, see what is happening when I am placing the probe in the subcostal region and giving a slight pressure as well. Now if you see that we are seeing this is the aorta in longitudinal section. This is the superior mesenteric artery arising from it, and this is the head of the pancreas in longitudinal section, which measures 3.6 centimeters into 1.5, and normal dimension of the head of the pancreas should not exceed 2.0 centimeters. So this is normal. This is the pancreas in head of the pancreas, and now see that its outer margin is regular, thin, smooth. Its echogenicity is slightly less compared to the normal liver. So this is how you can see the head of the pancreas. However, head of the pancreas can also be seen in this way. And now what you have to do is लंबा सांस रोको यार. Okay. Now see that again. I'll press the probe in the mid-epigastric region here, just below the xiphoid process, and may have to come a bit downwards or a bit upwards depending upon patient to patient. So by just angling the probe towards the subcostal region, this is straight, this is the subcostal region. Lamba सांस लें. Ask the patient to take a deep breath and hold, and now you can see you are getting total pancreas. This is the head of the pancreas. This is the body of the pancreas, and this is the tail of the pancreas. Okay, this is the head, this is the body, and this is the tail of the pancreas, and this is the liver, normal liver, and these are the duodenal bowel gases. This is the bowel, this area, and the bowels are seen on the lateral side of the pancreas as well. These are the stomach bowel gases and food material in it. This is the aorta in transverse section. This is the aorta in transverse section. So this is the complete view of the pancreas. Well, one important thing, this vessel is not splenic vein. This is splenic artery, and I will explain to you in a while. Don't be misguided by that vessel. This is the splenic vein, and you see, this is the splenic vein. This line, this structure. This is the vein. This is superior mesenteric vein. So it becomes continuous with the superior mesenteric vein. Then it makes here it joins the portal vein. It becomes portosplenic confluence. So we are talking about tail of the pancreas. Remember, it ends at the very close to the left kidney. For that, what you do is just now see the scanning plan. At times you will get it very easily, but at times you have to wait and maneuver the probe in a way that you can get your desired view. Now see, this is the scanning plan. Place the probe below the costal margin and then angle it in this way that the marker, you see the marker is down towards yourself or towards the subcostal region, pointing laterally. Now in this position I ask the patient to take a deep breath and hold it. Zara kindly, Salana Ekvaryu. Lamba Sajina Dora. And I angle the probe a bit downwards. This is the angle. Tada taklif karo. Sakicho. Patient has taken a deep breath, is holding the breath, and here. Now see on the screen that this is the tail of the pancreas, and the area which I am going to encircle is the transverse section of the left kidney. It is not that clear, but it is that the left kidney in transverse section. This is the aorta, superior mesenteric artery, the splenic vein, the body of the pancreas, the head of the pancreas. So you can get a glimpse of it. This is the left kidney in transverse section. This is the tail of the pancreas. This is the relation between the kidney and the tail of the pancreas. It should be known to you. It's of importance. So now, what you should be aware of is that this is the splenic vein that you are seeing posterior to the pancreas. This one. This is the splenic vein. Now what happens is, when you move the probe in the capillite position, from this position, see, when you will move the probe capillite towards the patient's head region, you will get, in this position you will get the splenic vein. Slight pressure may be required, mild pressure, and when you will angle the probe towards the patient's head, you will lose the splenic vein and you will be seeing the splenic artery in place of splenic vein. So remember, here or with little pressure you will see splenic vein, and if you go and angle the probe anteriorly, superiorly or capillary, then you will see the splenic vein, splenic artery and not splenic vein. Be careful about this. Now let's see the first view that this is the splenic vein, this is the pancreas, this is the aorta, this is the IVC, this is perimesenteric vein, this is splenic vein. Now when now I'm going to angle the probe. I am angling the probe capsuloid, and you see that in place of splenic vein you are seeing a vessel that is arising from the celiac axis and then curving here. This is the aorta and this is the celiac axis. This is the splenic artery, and you can see the pancreatic tissue anterior to this, but it's not, you will never see the splenic vein making a curve. It will be straight. Now the splenic artery will curve. We show you a curve. Here you see, this is the aorta, celiac axis, splenic artery, again you see, now I move the probe capsuloid towards the patient, angle the probe towards the patient's head, and ask him to take a slight deep breath and hold it, and I gave a little pressure, and you see this is the aorta, this is the celiac axis, this is the curved vessel. So differentiation is the splenic vein will go straight and then it will curve, but it will curve towards the tail of the pancreas, not towards the body of the pancreas. So this is the splenic artery arising from the celiac axis. This is the left gastric artery or hepatic artery that is arising from the celiac axis. The two vessels arise from celiac trunk or celiac axis. This is to be remembered, not to confuse the splenic artery with the splenic vein while you are studying the pancreas. And I think if you go on practicing on the normal patients as much as possible with the angles, scanning plans that I have provided you, I don't think you will need any academy to pay a lot of money and learn the normal ultrasound, because once you understand the normal, there will be no issue for you to pick the anomaly as you place the probe, the desired part of the pathology you are looking for. Though there are a lot of pathologies that you come across, and that takes time, and there is no shortcut to experience. But to start with, you have to be very well trained in the normal anatomy. So I have at least tried. I don't know how much I'm successful, but I'm not getting that feedback that I should be, because I am really trying hard to make you learn the normal without any fees. Now only this much of the ultrasound, if you learn in any academy or school, or they will charge even for this normal a lot from you, and they will not even you will in this area where we are living, you will not get this much of a detail from a tutor. That I can assure you. Thank you. Please give the feedback.